Good afternoon. I am Dr. Zahir Abbas. I am a vitreoretina consultant based in Kolkata. Friends, we are all aware that we are in the midst of the COVID pandemic, and since this is also the World Diabetes Week, so today's topic of discussion is diabetic retinopathy and the COVID pandemic. Now, just a few weeks back, I saw a patient, around a 54-year-old lady who had come to us with complaints of decreased vision in one of her eyes. Now, when we examined her, we saw that she had advanced diabetic retinopathy damage in her eyes. And when we asked her that why didn't you come to us before? So her reply was that, Doctor, I have diabetes, I have hypertension, and I was so scared to come to the hospital for an eye checkup. And then I saw that in one of her eyes, in fact, she has suffered a permanent loss of vision, and the only thing we can do is for the other eye, which we could treat. Now, what does diabetes do to our eyes? Now, diabetes can affect our eyes in many ways. It can cause accumulation of fluid or water in the central part of retina, which is known as the diabetic macular edema, and it can cause decrease in vision. We treat that with the help of intravitreal injections. And the other way diabetes can cause damage is by hemorrhage inside the eye. It can cause a retinal detachment and it can lead to permanent loss of vision. So in both the conditions, we must know that early treatment and early intervention is of paramount importance. Now, in this current scenario, when there is a COVID pandemic going on, the diabetic patients are just not coming to the eye hospitals and the eye doctors for checkup. Every now and then we get calls from the diabetic patients like, Doctor, I am seeing blurred vision in both the eyes. I have diabetes. So when can I come for eye checkup? Can I delay my eye checkup? Now it all depends that in what stage of diabetic retinopathy the patient is suffering. If it is very early stages, then he can wait. But if it is in advanced stages, then he must come for an eye checkup. Otherwise, if he delays his eye checkup, it can lead to permanent and severe vision loss. Now, what can we do in these situations? Patients are so much scared, so they feel that coming to an eye hospital can lead to, they can contract COVID infection, but it is not the case. All the eye hospitals of the city are taking utmost precautions to contain the spread of COVID virus, and patients also should take utmost precautions. They should come with a mask, and that should cover both the nose and the face and the mouth area, and they should observe proper hand hygiene and also a proper mask etiquette so as not to contract any infection from outside. Now, if these diabetic patients, if they come late to us, what can happen is there can be a permanent damage to the retina. There can be a form of macular edema which can become recalcitrant. That means even if we treat with injections, even then the vision may not be restored, or there can be a severe amount of hemorrhage inside the eye. The retina can get detached, and we may even have to operate on that eye. If the stage of diabetic retinopathy goes beyond that situation, then in fact the patient can lose the vision permanently. So I request all diabetic patients who have been receiving treatment before the pandemic and those who have been diagnosed as diabetes recently, they must ensure that they should come to the eye hospitals for checkup, take utmost precautions so that they don't contract COVID. They should wear proper mask, follow proper hand hygiene, and let us check your eyes and let us start the treatment, because if there is a long delay, it can lead to permanent and severe vision loss. Thank you.